And so that brings us up to the section on hCG. And I know that many of you out there have heard about hCG. You may already, some of you, be doing it. Anybody in the room already doing hCG? Couple? Few? Okay. I think all of you know that hCG is the molecule secreted during pregnancy by the placenta. It has two subunits. And so one of its subunits is actually very similar in amino acid sequence to some of the gonadotropins. In particular, it's very similar to LH, or luteinizing hormone. And luteinizing hormone, when the receptors are stimulated in the body, increase relative androgen activity. And so those would be the male type hormones, and there are receptors on the testes and the Leydig cells, and also in women in particular can increase progesterogenic type of activity and secretion. And so that's part of the mechanism of action of hCG. And hCG is already out there and being used for other clinical indications. We talk about in the anti-aging course one of the things that it's out there being used for, not an FDA indication, but one of the things being used for is male hypogonadism. And so the way that it works in this is by stimulating the LH receptors in the testes on the Leydig cells, which then in turn increase testosterone secretion. And so we do this for men in a couple of occasions. Patients that need testosterone replacement but may be young and want to preserve fertility, when they get the end hormone, which is testosterone, of course we have a negative feedback loop, and so it goes back up to the pituitary and the hypothalamus. Less testosterone is then secreted, less LH is secreted to stimulate the receptors on the testes. And so these receptors are not only on the Leydig cells for testosterone, but also the Sertoli cells for spermatogenesis. And so when we give testosterone, it does decrease sperm counts many times. And so in young men that want to preserve fertility, one thing you can do is substitute, instead of testosterone on a daily basis, you can substitute hCG sometimes for part of that testosterone, and that way you maintain stimulation of those LH receptors on the testes. The other time that sometimes we do this is if men have testicular volume loss, and this is a side effect of testosterone replacement also, and it's from the same mechanism. And so if we substitute hCG for part of the testosterone in that replacement regimen, many times we can prevent that side effect. And so for those two reasons, we sometimes will use that. Now the FDA approved indication for which hCG is used is female infertility. And it uses hCG in massive amounts, so 10,000 to 40,000 units, whereas we're using more like 125 to 175 units. These are huge doses over a very short time span, which result in ovarian stimulation and ovulation. So for female fertility purposes, it's used for that. The important part of that is that it is FDA approved.